Now, for the last drug amongst all the chemotherapy drugs that we'll be talking about is what? Bendamustine. Bendamustine. So this bendamustine is also known as what? Treanda. Okay. So it's actually a chemotherapy drug. We get to talk about its pharmacology, how it works, and all of that. Okay. So that this bendamustine is a chemotherapy medication which is used to treat what various types of cancers, particularly what the indolent B cell non-Hodgkin's lymphoma. Okay, and also we have the chronic lymphocytic what leukemia. All right. So for its mechanism of action, this bendamustine is a bifunctional. All right, it's a bifunctional alkylating agent and a nitrogen mustard derivative. It works by what forming cross links with DNA, so it will actually lead to what intra and inter-strand cross links. So therefore, DNA synthesis will not be able to go on as planned. All right, it will cross-link and prevent the DNA from what further growth. Okay, so it will inhibit DNA synthesis and function, and ultimately lead to the death of the cancer cell. Okay, so bendamustine is active against both dividing and quiescent cells. Okay, cancer cells that are dividing and the ones that are not dividing. For absorption, is administered intravenously. It has a volume of distribution of approximately 20 to 25 liters. Metabolism, it is metabolized in the liver by cytochrome P450 enzymes, primarily cytochrome A1, A2. Okay, so its main active metabolites, that's when broken down into the active form, we call them what? Gamma, okay, we call them what? Gamma-hydroxy-bendamustine. Then we have N-desmethyl-bendamustine. All right. So for excretion, the drug and its metabolites are excreted primarily in urine, 50% in urine, 25% in feces. Okay. Half-life. Elimination half-life of bendamustine is approximately 40 minutes, while its active metabolites are about what? 30 hours. Okay. Let me pick a call. All right. So what we're saying now, it actually has like two active metabolites. So one of the metabolites is the M3. So it takes like 3 hours for the M3. Then, all right, then 30 minutes for the M4. All right. So what we're having is for the clinical uses, we have already stated it. It's used in treating what? Indolent B cell non-Hodgkin lymphoma. Okay, that has progressed during or within 6 months of treatment with rituximab and rituximab containing regimen. That means like you actually treated it with rituximab, but it didn't actually work. You know, so you can actually what use this as a second option for that. So in talking about the administration is basically what through the veins. Okay, you see for injection. So injection is definitely what intravenous. Okay. So for common side effects, this could actually what lead to bone suppression, nausea, vomiting, fatigue, infections. Okay. It can also cause myelosuppression, hepatotoxicity, pulmonary what toxicity. Okay. So that's it for the pharmacology of what bendamustine.